Welcome to Governor DeWine's Tuesday COVID-19 briefing. I'm Terry Sullivan. Right now, let's do the numbers. They were released just seconds ago. There are now 28,952 cases of coronavirus here in Ohio, 498 cases more than yesterday. 5,117 people have been hospitalized. That's 119 more than yesterday. And 1,720 people have died total, 63 more in the past 24 hours. Annie Glenn, the wife of former astronaut and Senator John Glenn, has died. Her family says Glenn died early this morning at a nursing home near her family in St. Paul, Minnesota, from complications of COVID-19. Annie Glenn was 100 years old. ABC 6's Tara Morgan is covering the briefing for us today, and she joins us now by phone. Tara, what do you think the hot topics will be today?
You know, Terry, all I'm told so far is that it'll be a general update today. Dr. Acton, we noticed, is not on the press release to be here today, so it'll just be the governor and lieutenant governor speaking. We should expect remarks about the passing of Annie Glenn today. It's possible that the governor may talk about new federal money that was just allocated to the state of Ohio, $238 million for contact tracing and testing, which they have said all along is key in fighting this virus. So those are the expectations of today. You know, the restaurants will have dine-in coming up on Thursday. They could possibly talk about that as well, as we've heard a lot of talk over the issue with patio dining over the weekend and some of the restaurants who received some warning letters. So we could hear about that as well. Also, we just got confirmation about a fourth staff member at the Ohio Department of Rehabilitation and Correction who had passed away. This would be the second staff member at CRC, which is the Correctional Reception Center. So we just got confirmation on that. We will possibly hear more information about that death. This would be the second staff member death in 2 days at CRC. The other deaths were at Marion and Pickaway Correctional. So those are just some of the topics that we could hear about today.
Tara, what number did you draw in the lottery?
I they drew number 7 for me, so I don't know if that's a lucky number or not, but yep, there are quite a few people here in line for questioning, and I got number 7.
7 is a pretty good number. I think you'll get a question in today. Thanks so much for joining us right now. We will look forward to your reports beginning today at 5. Pelotonia has announced it is canceling the big ride thanks to the pandemic and is instead launching something called My Pelotonia on June 2nd. It allows participants to define personal challenges and fundraising goals in lieu of the community's traditional 3-day ride. There will also be a live broadcast that mirrors the Pelotonia opening ceremony the weekend of August 7th. The State Department of Education wants parents' feedback as they continue to work on a plan for possibly reopening schools next school year. State education leaders asking the Ohio Parent-Teacher Association to come up with feedback to their draft reopening plan. The Ohio PTA has set up a short online survey for parents, and they're asking 3 things. What are your main questions? Will you send your child to school if they reopen in the fall? And will you send your child to school if masks are mandated? As ABC 6 reported last week, masks are currently part of a draft proposal that's being offered as a guide for local school districts. Golf courses around Ohio can reopen May 26, but only if they're up to par with a variety of regulations designed to limit the spread of coronavirus. The new rules limit golfers' interaction and touching of surfaces, and it also requires workers to regularly clean and sanitize facilities and to stagger employees' work schedules and break times. Last time we heard from him, yesterday, the governor talked about the complaints that health departments received over the weekend about packed restaurants and bars. He announced he has expanded the Ohio Investigative Unit to include police and health officials, and that unit will surge into places to conduct safety compliance checks in crowded bars and restaurants. If they see any violations, they will be issuing administrative citations that could result in the place losing its liquor license. Prosecutors could also pursue potential criminal actions as well. The governor said most places were playing by the rules, but there were some places that weren't. He says business owners have to make sure that customers stay seated and are not mingling around, disregarding social distancing. Lieutenant Governor Jon Husted was talking about school-related sporting activities. He said the state will begin to coordinate with the Ohio High School Athletic Association in order to get a better idea of what can be done to limit the spread of coronavirus, but to possibly allow training for non-contact sports. What this means for fall sports remains to be seen. The governor also said that he has received a lot of complaints about hospital visitation policies. He said the state doesn't have any rules in regard to visitation at hospitals, but that those rules are set by the hospitals based on what they think is best policy. And then finally, the governor announced yesterday that on Thursday, he will have an update on things the state can do to help populations disproportionately impacted by COVID-19, such as the African American community. He said he will talk more about what the state plans to do because he said there are too many African American people dying from the coronavirus here in Ohio. Again, we are waiting for the governor and the lieutenant governor today. The state health director, Amy Acton, taking the day off from the briefing. So it'll just be the governor and the lieutenant governor, and our Tara Morgan is down there at the State House. Tara, do you think, are you hearing any rumblings of any kind of budget cuts that he might address today?
Hey, Terry. No, I have not heard any rumblings to that effect. Anything's possible with these briefings. So all I'm told is that it will just be general discussion. There are quite a few reporters here, so the budget topic might be brought up during questioning. So we shall see.
Yeah, I know that the packed patios were a hot topic yesterday, and you were looking into that yesterday for ABC 6 News. And the governor said, we reopened a bit, but we're not going to play that game. People need to socially distance in order to stay apart. And you reported on a number of citations that were handed out.
Right. Well, these were warning letters that I believe 10 restaurants received. And so, the restaurant owners that I spoke with yesterday, they want more clarification from the health department. That may be one question that we should pose to the governor, as they reopen on Thursday for dining in these restaurants. Maybe they need more guidance, or they'd like to see more guidance and not just have the health department come out and talk to them about what their expectations are.
Well, Tara, the governor is at the podium, so we're going to take a break and listen in.
Lord's University in Sylvania. They're the home of the Gray Wolves, and they have prepared frontline heroes for many decades. Lord's alumni are the nurses, the EMTs, teachers, social workers, police officers who we depend on every single day. Mary Sabin, who is a dear friend of Fran and mine, is now working there at Lord's. So we wish them all the best, and all the alumni all the best who are out there. I am signing an order today to lower flags across the state of Ohio to half staff to honor Annie Glenn. Annie Glenn, widow of astronaut and Senator John Glenn. She passed away, we're told, this morning at a nursing facility in St. Paul near her family. Annie Glenn was certainly the most beloved Ohioan. And I think we can say that there wouldn't have been a John Glenn, at least as we knew him, without Annie Glenn. The two were inseparable. The two were real partners. And theirs is truly an inspiring love story. She represented all that is good in Ohio, all that is good in this country. Fran and I send our condolences to her family. We're so very, very sorry. This is a great loss for Ohio. And just to conclude, John Glenn, Annie Glenn, John Glenn, Annie Glenn, true heroes, true great treasures. We were lucky to call both of them our fellow Ohioans. Second tie of the day. This is from Nationwide Children's Hospital to show my support for children's mental health and the hospital's ongoing On Our Sleeves movement. May is Mental Health Awareness Month. We know kids are going through extra stress right now. School disruptions, physical separation from friends, in many cases, family hardships. Many more kids may need our support. Nationwide Children's Hospital is truly a gem that we have here in Ohio. It's a great resource for the people of Ohio, great resource for the children. Here's a video about the hospital's efforts this month to shine a light on children's mental health.
1 in 5 children is living with a mental illness. During this challenging time, many more could be struggling in silence. On Our Sleeves, the movement to transform children's mental health is here to help. May is Mental Health Awareness Month. This month, for our kids, let's put gratitude on our sleeves, because a grateful mindset can significantly improve our mental health. On Our Sleeves has free educational tools and resources for families. Learn more at onoursleeves.org.
Growing Our Gratitude. Growing Our Gratitude is one of their programs. It's a great way to impact our mental health. Maybe tonight you can start a conversation with your children about gratitude. You might ask them, what are you grateful for? Sometimes that's hard to answer. But in this time of so many challenges, it really presents us with a chance to connect. It's a chance to reflect. It's a chance to see how each one of us feels about, what we can focus on that is in fact positive. If you're looking for other ways to help support your children with their mental health, there are free resources at onoursleeves.org. That's onoursleeves.org. Dr. Acton is not here today, so I will give some of the numbers. There are a total of 28,952 cases of COVID-19. That is an increase of 498 over yesterday's numbers. The numbers of Ohioans who have died from COVID-19 has increased by 63 over yesterday to 1,720. So we look at the numbers, and again, what I always look at is the trend lines, hospitalizations, and again, to look at this from a 21-day trend, and we will see that in the last 24 hours there was a spike. But what we have to really do is look at these from a big picture, look at the last 21 days, three weeks, and what we'll see is the curve is fairly flat. Same way with deaths and in cases, you'll see the same thing. Last 24 hours, 498 cases. 21-day reported case average 580. So these are numbers that we always look at. So let me talk about a revision of the order that we're issuing today. I want to go back a little bit in time. And we're calling this an urgent health advisory, Ohioans protecting Ohioans. Urgent health advisory, Ohioans protecting Ohioans. Since the original stay-at-home order, a lot has happened. Our orders have evolved, and the circumstances have evolved in Ohio as well. So it's now time for our orders to reflect the reality of where we are today. These really are the essential facts. One, Ohioans, through social distancing, have avoided overwhelming our hospitals, and we have flattened the curve, and that has been great work by all of you. Number two, a new number for some of us learning it, but we've been watching it for a while in Ohio. The R naught number is now 1-to-1. It had been 1-to-2, which simply meant that one person was, on an average, was infecting two people. Now those numbers are down 1-to-1. Number three, a lot of our fellow Ohioans have worked very hard to come up with the best practices for business as they reopen. Those best practices that have been worked out by business, by professionals, by people in the health community are now orders. We have put in place a specific framework for how business operates that was not in place when we issued our original stay-at-home orders. These new orders protect employees and customers alike. 4, our original stay-at-home order had exceptions, including such things as going to the grocery store, to the pharmacy, checking on elderly relatives, attending funerals, weddings, church services, walking in a park, to name a few. Each order, number 5, each order that has reopened a business sector has created additional exceptions to the original order, which has in turn created additional opportunities for people to leave home. 6, in fact, on April 30th, we changed the name of the order from stay-at-home order to a safe-at-home order. And so we are now moving from orders to strong recommendations. This is a new phase in our battle against the virus, and it really is even more incumbent as we open up Ohio economically. It's really more important and incumbent upon each of us to protect each other. Our new urgent health advisory is titled Ohioans Protecting Ohioans. It incorporates 6 feet of social distancing, a limit of 10 people for mass gatherings, frequent hand washing, other sanitation efforts, etc. It incorporates all the business orders about social distancing and sanitation, including employees wearing masks, as well as efforts to protect employees and other efforts to protect the public. All of those are incorporated in this new order. Let me talk about our most vulnerable Ohioans. Our new urgent health advisory considers our most vulnerable Ohioans as those who can suffer the worst impact from the virus. They include those who are 65 years of age or older. They include people of all ages with underlying medical conditions, including chronic lung disease or moderate to severe asthma, serious heart conditions, compromised immune systems, obesity, diabetes, chronic kidney disease, and liver disease. Our urgent health advisory strongly recommends that these Ohioans stay at home as much as possible. They should avoid places where they're likely to encounter a lot of people. When they go out in public, they should wear a mask, unless not otherwise indicated, and should practice good hand washing, hygiene, and should, of course, practice the social distancing. They should limit trips out. They should be exceedingly careful. That's for our most vulnerable Ohioans. And again, It is a significant number of people because it's not only those over 65, but it's also those with the medical conditions that we just listed. And again, these are not new. You've heard Dr. Acton talk about these medical conditions many, many, many times. Let me talk about the rest of Ohioans. For everyone else living in Ohio, we today call upon your sense of personal responsibility and accountability to others. Those Ohioans not considered at high risk certainly can carry the virus. They can spread the disease even when they're showing no symptoms and unaware they are carrying that virus. Even those Ohioans who are not the most vulnerable for death from COVID-19 are certainly vulnerable, we have learned, and we have seen. They're vulnerable to developing severe complications, such as a stroke, and experiencing long, extended stays in the hospital, as we heard from the two individuals who called in the last few days. Our health advisory recommends, but does not require, it recommends, but does not require that those Ohioans, the rest of the Ohioans, stay at their place of residence when possible with the intent of lowering the rate of the spread of COVID-19. Young, healthy Ohioans should take protective action, and any Ohioan should take protective action because they could unknowingly pass this virus on to one of their fellow citizens. All individuals in Ohio are advised to take precautions to limit the spread of this disease. And again, this could occur unknowingly, as we know that there are many people who carry the virus, but who do not show symptoms and certainly do not know themselves that they have it. Let me talk a moment about travel. While orders have included limited travel restrictions, these will now be lifted. However, while unnecessary travel within or outside of the state of Ohio is permitted, it certainly is not encouraged. And we certainly, while it is permitted, advise people to make their own judgments by whatever the situation is, who they have in their household, who they are traveling with, and where they are traveling, and who they interact with when they travel. Again, these are up to each individual. We would just ask that they be cautious. Persons who have tested positive for COVID-19 and have not recovered or are presumptively diagnosed with COVID-19, or if they are exhibiting the symptoms identified in the screening guidance available from the CDC and the Ohio Department of Health, shall not enter the state. This is not a change, unless they are doing so under medical orders for purposes of medical care, or being transported by emergency medical services, EMS, are driving or being driven directly to a medical provider for the purpose of initial care, or a permanent resident of the state. Ohioans take care of Ohioans. That is really the core of who we are. And Ohioans have done this very, very well for the past several months. It's how we flatten the curve. That's how we have helped slow the spread of this deadly virus. That's how we have saved the lives of many Ohioans, our neighbors, our friends, our loved ones. And that is how we are going to save our economy. That's how we're going to grow our economy. Because we cannot separate keeping safe, keeping the virus spread down, and growing the economy. Without keeping that virus down, we cannot recover economically, nor, of course, can we recover from a health point of view. The coronavirus is not gone. It is real, and it is deadly. This new phase that we're now in is about learning to live with the virus. It is with us. It will remain with us for a while. And we must do all we can to contain it and keep it from killing our fellow citizens. What this comes down to now is that each of us has a responsibility to each other to slow the spread. No other time in our lives, no other time, my guess, for all of us, we will have no other time in our life when our own individual actions or inactions can impact the lives of so many of our fellow citizens. The virus, of course, has now become one of the leading causes of death in Ohio. Preliminary research indicates that as of May 19th, more than 90,000 people in the United States, including 1,720 Ohioans, have died with the COVID-19. These numbers, as we have seen here, continue to increase daily. Cases have been detected in all 88 counties. The majority of hospital admissions and deaths are among adults age 60 and older. However, another interesting statistic, nearly half of reported COVID-19 cases in Ohio are among adults ages 30 to 59. The risk to the health of all Ohioans does remain high, and we must protect each other. We owe it to each other. What we do individually will be what saves Ohioans collectively. Taking the protective actions that we are recommending today will not only help you, but they will help protect your loved ones, they will help protect your neighbors, and they will help protect people you do not even know. The concept of love thy neighbor is as old as the scriptures. It is something that we all believe. It is something that will protect your children, your family members, your mom, your dad, your grandparents, your friends, your neighbors, and your fellow Ohioans. By taking personal responsibility, Ohioans are taking the most aggressive action we can against the virus. We have control of this. Our economic recovery and success as a state is dependent upon our respect for one another. And it's dependent upon each of us taking personal responsibility to keep the other one safe. I truly believe Ohioans have risen to the challenge in the past. We will continue to do so as we move through this period of time. Yesterday, I told you that we had our first resident cases of COVID-19 in our state veterans home in Sandusky. Just a short time ago, sadly, our Ohio Department of Veteran Services informed me that a veteran who was confirmed positive did, in fact, pass away today. We're saddened to hear about this, and we offer condolences to the family. As I told you this week, I directed the Ohio Department of Veteran Services to work to test all residents and staff at both state-operated veterans homes in Sandusky and Georgetown. The latest total numbers from the recent testing are as follows. At the Sandusky home, 28 residents have tested positive, and so have 5 staff members. At the Georgetown home, no positive cases to date. At both facilities, a total of 818 staff and residents have tested negative. The Ohio Department of Rehabilitation and Correction informed me today that sadly they are mourning the death of another colleague who became ill from COVID-19. DeWine Pete Gannon, 58, had been a corrections officer at the Correction Reception Center in Orient since July of 2010. He'd been off work with symptoms of the virus since April 20th, and he later tested positive for COVID-19. Our thoughts are with his family and with his friends and with his colleagues. BWC will begin distributing at least 2 million face coverings to Ohio employers who are covered by BWC. Now, these will be for the use of employees. As businesses and companies begin to reopen, it's vitally important to keep employees and customers safe. Many of the advisory boards who have helped us with the various plans on reopening emphasize the importance of employees wearing face coverings. Employers who are covered by BWC, including public and private employers that participate in the state insurance fund, will receive a package from BWC containing at least 50 face coverings. These packages will be shipped in batches beginning this Wednesday, May 20th. These masks are funded through BWC's existing budget and will not impact premiums. I'd like to encourage companies and employees to not throw away any extra face coverings that they receive that they won't be using. If you receive more than you need, we ask you share them with others in your communities who may also need them. As more businesses reopen, Administrator Stephanie McLeod and I will continue to monitor and identify possible ways to continue providing assistance to Ohio businesses throughout the state. As Dr. Acton and our team of experts have said, these face coverings are very important. They help protect others. Lieutenant Governor.
Thank you very much, Governor. Good afternoon. Got one thing that I want to emphasize as we are focused on the reopening, and then I'm going to do a little history lesson and some context. But the May the 26th, next Tuesday, BMVs across the state will be open. However, the one thing that we're trying to prevent is everybody rushing out to the BMV on Tuesday, thinking that they have to be there, that they have to renew their license, that they, and then creating the problem of not being able to handle everybody at the BMV, creating crowding, spacing, and those issues. The last thing that we want to have happen. So this is a reminder that that most things that you need from the BMV, you can do online. Go to bmv.ohio.gov and go to the online services tab, and you will see all of the things available through that service that you will be able to get be able to accomplish online. If you have a driver's license or an ID card that has expired, remember, it is still valid because we were able to, with the help of the legislature, get that grace period extended through this emergency. So don't worry about that. Don't feel that you have to run out and do this on Tuesday just because the BMV is open. So again, encouraging people to use the online resources. If you do plan on going, use the Get in Line online tool so that you know how long the wait is and you can space that out and not have to go there all at once. So these are a couple things that we want to emphasize as we move toward that opening a week from today, I guess it is. Additionally, look, the governor announced some changes today in how we want people to how we're loosening restrictions and allowing people to have more responsibility in how they conduct their lives. And it reminded me as we were discussing this morning of the context, because a lot of times we get asked questions, well, why are you doing things this particular way? And I want to take a moment to try to explain how far this has all evolved in just 2 months. Because I remember the first time I talked to the governor actually about the idea of closing down the Arnold Sports Festival, which was really the first act that we took. And it seemed so abrupt to me. It seemed like, well, what are we doing? And then we sat and we talked with the health officials because we didn't know what we were up against. None of us did. Nobody in the world, nobody at the national level or at the state level really knew what we were facing. The most important thing we could do at that point is to listen to the experts, to take the health advice, and they urged immediate action to stop large gatherings. And so many aspects of our life slowed or stopped completely. We didn't know what we didn't know at that point in time. The strategy worked. The curve was smashed. We had in Ohio fewer fatalities than other states in our proximity who didn't take the early action. But even though that was a success, there were still over 1,700 people in Ohio who've lost their lives and tens of thousands who have been sickened by COVID-19. And it's still very much a threat in our lives. But since March, since those early days, we've learned a lot about how to manage our risk individually and collectively. Health professionals have learned more, businesses have learned more, public officials have learned more, and nobody has all the answers. And sometimes even those answers are not clear. But without a vaccine, we concluded pretty early on that we're going to have to learn to live with COVID-19 in our lives. And we had to develop strategies and protocols as to how we were going to do that. That we must learn to manage that risk individually and collectively. As been said during this 2 o'clock news conference many times by the governor, myself, Dr. Acton, action to open things up has a risk. We also know that inaction, failure to act also has risks in terms of not only people's mental health and other aspects of their health, but also to the economy and to our society. It's always been our goal to use the best possible information we could find to strike that balance and to do it at a very fast pace and try to build the confidence that we were making the right decisions by you, the people of the state of Ohio. And we were able to develop, working with business and health. It was a fascinating process to hear the health officials talk about what worked best, to hear business people talk about what worked best, with the goal of keeping employees and customers safe and to rebuild confidence. And over that period, throughout all those discussions, starting in early May, we began to open things up. And looking at the most recent data that I was able to glean, by the end of May, with everything that's coming online, about 95% of the Ohio economy, private economy, will open. And basically, this was either at the same pace or faster than most of our bordering states. Today, with the further loosening of restrictions on the stay-at-home order and the travel requirements in our personal lives, we are taking another step, and we will work to deliver more of these things. We hopefully will have some more things on Thursday to talk with you about. But as we resume these activities, the success of this phase, the true success of this phase, depends on that individual and collective responsibility. I think about it from a health point of view. We just are adding some health advisories to our lives because we know that we always hear we should eat healthy, we should exercise, and we should get adequate amount of sleep. What we're really adding to that list is we want people to distance and disinfect and wear a mask when you can. And what do we know about both of those pieces of advice? Is the more people do it, the healthier we will collectively be. And it is our job as public officials to give you the best information that we can on how you can reduce your risk. That's what health officials do. That's what your public leaders do. How can we inform you with the best possible advice and the best rules and regulations that we can to find that balance to keep you healthy? And what all of these things that we've been doing are about reducing that risk for you, for businesses, for employees, customers in our society. And we're now at that phase where our goal is, frankly, to just continue to educate and persuade all of our fellow Ohioans to do the right thing by each other. Ultimately, it will be up to each one of us to do that. And we have tried to make informed health, safety, and economic policies and recommendations as we go through this, and we will continue to do that as we are going to face the threat of this virus for some time. But in the end, no order and no law will be as successful as a well-informed public who simply cares and respects each other. And as we stand here today, that's our collective mission for all of us in Ohio as we move forward. Governor?
I think we're ready for questions.
When it came to reopening the economy, you've said that you prefer a statewide policy as opposed to a county-by-county opening. You've also said and you said it yesterday, that you're willing to pull back, start closing things down again if things don't go well. Does that mean that any reclosings of business would also occur on a statewide basis rather than be hotspot specific?
Well, that's a very good question. I don't think we know the answer to that. I hope we never get to that question. You know, as we have said, local health departments have the ability to issue more restrictive orders. Whatever they're finding that's local, that's unique to them, maybe because they're in a city, maybe because they're in a certain part of the state. So they have the opportunity to do that. And that's true right now. That has been true throughout this. So, I hope we don't get to the point where we have to pull back. We've seen that happen in several European countries where they started, they closed, they were able to open, all excitement, and then they're starting to close back again. So what we do in the next, few weeks is going to really determine exactly where we are. The numbers that we show you on the screen every day or the numbers that we look at. We're looking at every number we can get our hands on, and we're trying to see, if the trend line is going the wrong way. So there's a lot of variables out there, but the most important variable is what Ohioans do over the next few weeks. We're trying to do all the other things we can do, ramping up testing, ramping up tracing, making sure the PPE is out to everybody. Those are things that we have the responsibility for, but Ohioans ultimately are going to determine, how much social distancing there is, how much spread there is, and that's going to determine where we're able to go. And I would just repeat something I just said in the statement because I feel so strongly about it, that our ability to recover economically is tied at the hip to the whole issue about public safety and public health. You cannot separate the two. And if one goes down, the other is going to go down. So if the health is going down, no matter what order we issue, don't issue, it's not going to help. So these are just tied like that together, and I think everyone needs to kind of get that as we move forward.
Yeah. Can I add to that understand that the adequate testing is not something we had until recently. So that's not a strategy that we could deploy earlier on when you're looking at a statewide policy versus local issues. So the fact that we have testing now and tracing, and that will continue to improve, will help mitigate hotspots, and that's the hope.
Hello, Ben Schwartz with WCPO in Cincinnati. Governor DeWine, WCPO is still receiving a whole lot of questions, or really just concerns from viewers who have still not received any unemployment and haven't really heard from the unemployment offices at all. I know I've asked about this before, and I've been told that your administration's working hard on it, but I want to ask if there's any message for these people who are fed up and frustrated. It's been a couple months at this point, and with the economy starting to open back up, if any changes could be coming.
Well, the message is, I apologize. We're very sorry. The people who are working there, that's now up to, I think, about 1,600, are working at this every single day. But that does not, lessen the pain of not getting that check. That does not lessen the aggravation when you're on the phone and you're trying to get through. So, we're going to continue to focus on this. And again, I apologize for, those who have not gotten it yet. John, you probably have, I don't know if you have recent numbers on that or what you have.
Yeah.
But,
well, the best, and first, and let me just say to Ben and to your viewers and people asking those questions, it weighs heavily on us because we can empathize with the situation that they're in. If you are without a job and you're waiting to get your unemployment benefits, it's a very scary and unsettling time, and that is not lost on us, and we understand that. Director Hall understands that, and the staff understands how much we collectively want to serve all of those customers as quickly as we can. They have processed payments and resolved over 91% of the cases that they have so far. But if you're part of that 9%, it's still a large number of people. That's still tens of thousands of people who have not had their issues resolved, and they are working diligently to get that done. While I see the data come in, it's getting better. It's still not where it needs to be, just because of the volume of both claims that have to be processed and questions that have to be answered, and the accountability that must also be incorporated into that process to make sure that we're not paying out dollars for people who are not eligible for them. And Director Hall continues to push for both the tech reforms and the person and putting people to work on solving these problems. But it's not lost on us the personal impact this having on people's lives, and we push 7 days a week to try to get them served.
Thank you both very much.
Hi, this is Molly Martinez with Spectrum News. Lieutenant Governor, you just said something poignant. You said no law will be as effective as a well-informed public. But this weekend, we saw crowded bars, we saw packed restaurants, we saw patios, we saw really people who have information willfully ignoring it. My question is either for the governor or lieutenant governor, is there any concern that we are putting too much faith that people will do the right thing when we've seen example after example that they are choosing not to?
No, I don't think so. I mean, Ohioans have demonstrated in the last 2 months that they will use their common sense. They will do what needs to be done. I think my life experience with Ohioans, I think we're a practical people. I think we're people who just roll up our sleeves and do what we need to do every day. And that's what we're simply asking Ohioans to do as we continue this. Look, were there some things this past weekend that we didn't want to see? Absolutely. But the story, as I get it reported to me from around the state, from county after county, is that by and large, restaurants were doing a good job. Bars were doing a good job. Most Ohioans, when they went into one of those establishments, were keeping a distance that they should have kept. Part of this is kind of a learning curve. One of the messages that we're having to bars is you own it, you control it. You need to make sure that people are doing what they need to do. And for the few the patrons who maybe you're paying no attention, I would just appeal to them again, pay attention, because you may not worry about your life, you may not worry that you're going to catch anything. But we got a lot of Ohioans who are walking around who have the virus and don't know they have it and are spreading it to others, and you don't want to be in a position of killing your grandmother or killing someone that you love or someone you don't even know. And so this is serious business. This is not something that we've gotten through. We have a long way to go, and we will get through this. And every one of us wants to get through this on the other side and be there when we can open everything back up and we're going to baseball games and we're going to see our grandkids and we're doing everything that we want to be able to do. But you got to be alive to do that. And so that's, I guess, just my message to those who are maybe last weekend were having a good time. Nothing wrong with having a good time, but maybe we're not as cautious as they should have been. John?
Yeah, thanks, Governor Molly. Reiterating, most people have done this right. We squashed the curve and avoided thousands of deaths that we otherwise would have had if people hadn't followed the rules and done this right. And we have little choice but to trust people. A civil society, frankly, depends on public trust. It just does. And what at this phase, that point I was trying to make is that we want to hopefully educate, persuade, maybe even inspire on occasion people to do the right thing by each other. And that's not just true now. A great society of a thriving society is dependent upon public trust with each other. That's what our economy is based on. That's what most things that we do in life are based on, is that trust. And we want to build trust in this process, not violate it. And enforcement has been a very rarely used tool in this entire process. It was only for egregious situations that enforcement has ever been thought of as a tool to do this. And so public trust has been at the foundation of all the success that we've had thus far.
Thank you.
Jack Windsor, WMFD TV, Mansfield. My question is for the governor. Governor, when you consider that since April 15th, 67% of deaths attributed to coronavirus are in long-term care facilities, and once we go back before the 15th, that number will be even larger. Seniors in congregate settings account for less than 1% of our population, but yet are overwhelmingly the most affected. Governor, is it time to ditch focus on things like contact tracing, bars and restaurants, and whether or not kids can chew gum on a baseball field, and to focus time, energy, and money more on solving the problem in our long-term care facilities?
Well, Jack, we've talked about this before, and we know that the most vulnerable members of our 11.7 million Ohioans are those who are older, or those who have a physical problem. We talked about diabetes. We talked about obesity, other things. So we know statistically that these are the most vulnerable members of our society. But we also know that someone can be a carrier, and they can carry that to someone who has more vulnerability. We also know, and we've seen on the screen, you saw it yesterday and the day before, people who were not that old, not very old, who told you about and told the people of the state of Ohio about their hospital stay, 2 months hospital stay on her back yesterday. So, I would not minimize that. I would not minimize what that does to someone's life when for 2 months they're in a hospital. They live, and so it shouldn't be just the deaths that we count. It should be the lives disrupted, the lives changed, and those include people of all ages. That doesn't mean we shouldn't concentrate, on the old people who have a physical problem. I mean, if you look at the order that we issued today, we have a separate section where we talk about people who are the most vulnerable, and with special cautions to those individuals. And at this point, as we deal with this virus, people are going to have to sort out in their own mind how they deal with it themselves. But you cannot get beyond the fact that everybody can be a carrier. And I don't know how this pandemic compares to other viruses, but at least with this one, we got a lot of people out there who are not showing symptoms, who are carrying this virus and who are spreading it, and they don't even know it. So, again, caution for everyone is, I think, the most important thing.
Your order on May 14th, though, if I remember correctly, said that those who were symptomatic were most likely to spread, but now what you're saying is that the asymptomatic are spreading. It seems to collide. Can you clarify?
No, I don't recall if we said that, Jack, but we continue to learn. We continue to get data. If you look at the data we got out of when we checked prisoners, we tested prisoners. Those were just stunning numbers of how many prisoners, and we knew exactly that they did not show symptoms because we were watching them every day. They were in prison, and they showed no signs, and yet a large number of the people who tested positive, the people who tested positive had absolutely no signs, none. So we've learned. We continue to evolve and we continue to learn. And what we do is we try to continue to share that with you as we learn that.
Kevin Landers, WBNS 10 TV. Thank you, Governor. The wedding businesses in Ohio have been severely impacted financially by COVID-19. As we approach the peak of the wedding season, your administration hasn't given a lot of guidance as to when wedding venues can reopen to allow more than 10 people, and many have canceled their weddings. And these businesses, including caterers, want to know, where does the state have to be in terms of the number of cases or deaths on the spectrum in order for them to reopen? And in that same vein, can people with overnight surgeries soon be allowed to schedule appointments anytime soon? Thank you.
Well, the latter question, we're going to continue to check with hospitals. Look, we depend on hospitals, the data in regard to PPE and what impact the surgeries are having on them, but also we have to look at the PPE generally, not just in regard to hospitals. So we're going to continue to look at that, and when we get to the point where we think it's safe to do that, we're certainly going to do it. I mean, anybody who's got anything serious, even if they spend the night, they can certainly get that done today. What we're talking about is elective surgeries that are not, when someone is not spending the night, they can do it. If someone has to spend the night, then it's a question of only those that are necessary at that point in time. So we've opened it quite a bit. There's a little bit more to go. We're going to keep looking at that. The other part of your question had to do with weddings, and as I recall, our order, weddings are exempt, funerals are exempt. So in other words, while we ask people to practice social distancing, and Fran and I have been to two funerals, unfortunately two funerals in the last 10 days, I think, and where people were practicing that social distancing. We're doing a phenomenal job. But they are not covered by any order that we have issued. What was covered is wedding receptions. And so we have been contacted by people who cater, for example, who've said, look, if we can replicate what the standards are in a restaurant, is that good enough? Can we go ahead and can people have a wedding reception if it replicates what we find in a restaurant? And we are looking at that. It would seem to me that makes sense. We're going to, again, try to work out those details, and we should have something shortly as far as advisory in regard to that. Again, when people ask the question or they look to us for these, we always come back to distance. Is the distance kept? Because the distance is the key. And what you worry about, whether it's at a bar, at the bars, where you worry about the congregation of people standing up close together. You may see that in any kind of gathering. That's the concern. And so that's why, in regard to the bars and restaurants, what the order says is you got to have tables, and people are assigned to a table. They sit at a table. I mean, so you can build in your social distancing then. And it would seem that that you could do the same thing with a wedding reception.
Thank you.
Hello, Governor. This is Laura Hancock with Cleveland.com. I'm seeking clarification on what you announced today with Ohioans protecting Ohioans. Is this an order with criminal penalties, or is this just a health advisory with no criminal penalties? Is somebody going to need to sign it? And where's Dr. Acton today?
Dr. Acton was not feeling well today. I found that out as I was coming in because I had talked to her earlier today. It is an order, but as you could tell from the order, most of that is really an advisory. It is what we call an urgent health advisory. We're serious about it. It's important. People need to listen to it. But, as we have evolved, and again, I think it's important to go back quickly. When we started the initial order, we had no orders on in regard to how business conducted business. Today we do. Today we do with barbershops. Today we do with hair salons. We do with restaurants. We do with other retail. So all those over 2 months, those have been developed and are in place. So people, should feel safer. They can be out. The requirement of a mask. I know sometimes people look at me and say, well, you guys didn't have that requirement a while ago. Well, we didn't have it when we were closed. We got more medical information, but also we're now in a situation where we are opening up again. And so that added protection makes sense. So most of what, Laura, most of what I talked about today is just, very serious advice, and where we're asking people to use the best information they can get and to be as safe as they can and to protect other people, which is really I think if there's a message today, it is we all have a moral obligation to protect others. And this is a time in our history when we have the opportunity to really, really do that. And what we do is not all about us. It's not all about, me exercising my individual freedom. You can do it, but it seems to me from what's right and what's wrong is we have an obligation, each of us, to protect other people when we have that opportunity to do it. And during this virus, we really have the opportunity to do that.
So is just the business aspect of it punishable, second-degree misdemeanor, and the rest of it's not? Is that what you're saying?
Any part that is an order is an order and carries with it, the penalties, potential penalties. I mean, look, this has not been, we have not looked to be charging people with offenses here. I mean, if you go back and look at the history for the last 2 months, but Ohioans have certainly complied, and so there are things that have, as we've made exceptions to the stay-at-home order. We have layered on requirements, and the requirements that were not there before. So yes, those have the force of an order. A lot of this that I read today is not an order. We're asking, and we're trying to give people the best science that we can and giving them the best recommendations we can so they can protect other people.
Good afternoon. This is Tara Morgan with ABC 6 News. Could you provide an update on contact tracers and the job search? I understand from the website that they're no longer taking applications, that they received an overwhelming response. Can you discuss a little bit about that and when things will get moving?
Sure. And let me just pause for a moment. This tracing is very, very important. I was on the phone talking to health departments all over the state this morning. And I told them how important tracing is. They already knew that. But what I said is, look, we're committed to continue to increase the testing, and we're doing it as fast as we can, and it will continue to increase. As we are doing that, we have to at the same time stand up a fairly significant number, 1,800 tracers around the state. Our goal is to hire at least 100 at the state level. I think we've hired 60. Most of them are in some training now. And what we're doing at the state level is to try to surge in if there is a hot spot somewhere, and let's say in Brown County, and they don't have the ability to handle that, we want to be able to, on the tracing part, surge people in there. The rest of the hires, though, are hires that are being done at the local county level. And I don't have numbers on those, but we will have those shortly because I'm asking my team to get me those numbers so we can see how we are doing. We're taking some of the federal money. We're putting out to local health departments. We're hiring people. And again, this is something that is really important as we look to where we're going in the next few months, in our ability to search out the virus, to separate it, to stop it. That depends on tracing. And again, tracing is probably as old as it goes back, probably at least to the plagues of the Middle Ages. It's a basic concept. Now we have testing to go with it, but it's not a new concept or a new practice.
Thank you.
Terry. Oh.
Hello, Governor. This is Luis Gil with Ohio Latino TV. And thank you very much for your leadership. And I'm sorry, I don't mean any disrespect with this question. But from the very beginning, you have asked Ohioans to work together, for patience, to be together on this, and together we get through it. As this past weekend, opened up the restaurants and some businesses, obviously there were some violators. And when they were visited, the inspectors of the officers did not go there on a friendly, patient, let's work together. As a matter of fact, during the news, they had threatened to take their licenses and so on. How is this going to work out together when the industry, the special restaurants and bars, has been through quite a bit? And is this going to be part of the history on their organization?
Well, I think it's going to work out well. I think if you look at what happened last weekend, the first weekend we saw this, most restaurants did fine, most bars did fine. Those who didn't do fine, we're going to chalk it up to a learning process and assume that they're going to get it right as they get crowds on Friday and Saturday and Sunday and Monday. Now, is there going to be enforcement? Well, sure, there's going to be enforcement. There's always enforcement. I mean, the local health departments, one of the things they do is regulate restaurants. One of the things they do is regulate bars. Our special investigators out of the Department of Public Service, they go out every weekend, and they're out there, and they'll be out there again this coming weekend. So, as I told law enforcement, I had a phone call with law enforcement this morning around, some of the representatives of law enforcement agencies, actually. And one of the things I said was, look, we hope to have a quiet weekend. We hope you don't have to issue any citations at all. But if somebody is not controlling the environment there, and we're going to hold the people who own the bars and who owns the restaurants ultimately accountable. The idea will be to work with them, but they've got to get control of the situation if the situation is out of control. It's just as simple as that. It's not fair to all the other bars and all the other restaurants that are complying, trying to do a good job, trying to serve their customers. If you have an outlier, that is not doing what they should be doing.
Thank you, Governor.
Hi, Governor. This is Shane Stegmiller with Hannah News Service. With you easing your travel restrictions in today's order, can you talk about what it means, what you would say for families who are considering doing some kind of summer vacation or traveling for the upcoming holiday weekend, what this means today?
Okay, I think that it simply means use your common sense, and a lot of different variables. This COVID virus is in every state, some more than others. I think that I would watch as I went. I would watch who I interact with. I would try to keep that interaction to a minimum. If it's just basic common sense. If you have someone in your household who's at a high risk, you're going to look at things differently than if you don't have someone in your household with a high risk. John worked on these. John, you got anything else to add to that?
No, I mean, one of the things, remember how the old order looked? The old order requested or asked people to self-quarantine if they left the state and returned. And that no longer will be in the order.
And that was an ask at that point.
It was an ask.
Anyway,
It wasn't
it was
a
never an
requirement.
order.
We were asking people to do that because remember when that started? That started back when we had people that were taking spring breaks and they were coming back to Ohio. We had other states Michigan, New York, where we were having people where that was really bad who were coming into Ohio. So that travel request was really to try to mitigate that circumstance. But we've gotten past that. We know that people are headed into summer vacation time and Memorial Day weekend. And so we get that. People are, but whether you're in Ohio or out of Ohio, the same general advice exists, that we want people to distance. You should keep to your own group of people that you're commonly interacting with. You want to disinfect, you want to wash your hands, and you want to wear a mask if you're around other people where the spread could occur. So it's just those common sense things that we've always done. And as the threat of the travel to Ohio from other places is lessened, it makes sense to move away from that provision and allow people to again begin to resume more of the normal things they would do, with the constant reminder that coronavirus can be a threat in your lives and in the lives of your loved ones. So please take precautions.
And just to clarify, you're not asking people to quarantine when they come back now?
No, not unless. Look, again, it's kind of the basics. If they're carrying a fever, if they're showing signs, absolutely. But that's true of anyone. We're asking anyone to to quarantine. So if you come back and you're sick, you would be. But if you come back and you feel okay, then no, we're not asking people to do that.
Thank you, Governor.
Hi, Governor. Julie Carr-Smythe from the Associated Press. Yesterday, Dr. Acton said that you have a whole team of people who are going to be testing at all the nursing homes. And, we've seen the president direct people to do mass nursing home testing. He said that on May 11th. You have expressed some reservations about whether we are able to do that. Could you talk about what we are and aren't going to be able to do in the nursing homes?
You saw what we did at the two veterans' homes, and the National Guard was involved in one of those. General Harris is standing up a group of at least 10 units that will be involved in the next few days in beginning to test at nursing homes. In addition to that, we are reaching out to our three regions and our partners in those three regions with the different hospitals and major hospitals to take the lead in those nursing homes as well. So we'll have more details in the next few days, which we will share with you as soon as we get them. What we want to do is to have testing certainly in nursing homes, and what we're doing, testing in nursing homes where there's someone who shows signs that they have COVID-19. Then the tracing needs to occur. So you're doing tracing. At the same time you're doing the testing, and of course tracing. If it's a staff member, then the tracing obviously is out into the community as well as in the nursing home. If it's someone who's a resident of the nursing home, then you certainly at least start there, and that's where that will be. So the testing and the tracing have to go together, and taking the data from the from the testing is very important. So we are in the process, and this is why increasing testing is so very important. We're a lot better off than we were. We're not where we should be, not where we want to be, but we're working on that to increase that. We're up to, I didn't look at yesterday's numbers, but we've been averaging somewhat over 9,000 for the last few days. That's better than we were the previous week, better than we were the previous week, but it's not where we want to be. So we're going to continue to ramp that up. So the summary is, in regard to nursing homes, any congregate care, they are a priority because we know how fast something can spread, and this is a very vulnerable, by and large, a very vulnerable population. Every state's got the same problem. If you look at, numbers out of every state, and when I talk to my fellow governors, we all just talk about, the nursing homes and what else that we can do. So we're going to push the testing as hard as we can in these nursing homes, and I think in the next 7 days, we're going to be able to report to you, a lot more progress in that area, and we're going to continue to do that. So we'll keep you informed as these things move forward, but that is where we are today.
Okay, appreciate it. This is Jackie Borchert from the Cincinnati Enquirer. Governor, you've said all along that you're making these decisions on the advice of experts and the best science. So my question is, what is the science behind these changes that you're announcing today, and why today?
Well, I guess the way I would look at this is what we're issuing today kind of catches up the order from what the reality has been. We started with an order 2 months ago that did allow people to go out, limited, but it allowed them to go out for certain reasons. Once we started opening back Ohio, in every case, the science is that we put in place the best practices that we could come up with. The best practices for hair, the best practices for retail, the best practices for manufacturing. In each one of those cases, we put orders in. But we also then, obviously, with retail and restaurants and bars and salons and all of those things, that carved a new exception to the travel, to the stay-at-home order, a new exception, new exception, new exception. So you get to this point, and yet you look at it, and the original order wasn't really where we were. And so what we wanted to do, because I think a lot of this is is for people to see what we're doing and have confidence in what we're doing, whether they agree with it or not, at least to see what we're doing and see that we're trying to be consistent. And so now was the time, after these openings and these orders have been issued about things that will open up shortly, to really take this order and turn it into something that is spot on in regard to where we are. I've been very open about where we are. I mean, this R0 number is important 1-to-1. When it starts to get higher, we're going to start worrying if it does. If it gets lower, obviously, we'll be very, very relieved. So we're going to watch that number. We're going to watch the hospitalization number. We're going to watch the case number. Hospitalization number I always find to be it's a lagger as far as an indicator, but it's also something that I think to me is pretty accurate about where we are. Cases depend to a lot of extent on how much testing you're doing. So as we do more testing, we're going to see the more cases go up. But the hospitalization is an important number. So all these numbers we're going to look at, and we're going to continue to follow that science. And this is why I urge Ohioans to continue to distance, continue to wear a mask now. As we open up Ohio, we didn't have Ohio opened up before. Now, put the mask on because we need that extra protection. And we're going to monitor how we're doing, and it's basically how we come out of this is going to depend on a lot of different things, but part of it is how well we continue to do the social distancing.
A quick clarification.
Can I add a piece to that I want to emphasize, Jackie? We've learned a lot from the very beginning. When this all hit, we didn't have access to PPE or masks or an adequate supply of hand sanitizer. We didn't have the 2 months of experience of businesses operating where they have been able to successfully do so without having spreads in the workplace. And so now that you have that experience and that information and know what best practices work, you can have a lot more confidence in these new decisions that we're making. And that also is an important factor when we're developing these work groups and coming to these conclusions.
Governor, real quick, you mentioned R0. Is that a figure that you're able to look at within, say, the last few days of time? Because the chart that was shown yesterday showed that it's basically up until about 2 weeks ago.
I don't know the answer to that. I don't know what lag time there is on that. I'll find out, though.
Thank you.
Good afternoon, Governor. Randy Ludlow with the Columbus Dispatch. Since apparently the order will not be issued today, or advisory or whatever you want to call it, will not be available today in writing, and a lot of confusion remains, at least as evidenced by readers and my editors, to clarify a couple of things. Coronavirus precautions placed on businesses previously remain in place, correct?
Coronavirus orders remain
on
in effect on
social
business.
distancing.
Absolutely.
Okay.
Absolutely.
And the restriction on mass gathering still applies to individuals, correct?
Yes, with the exception of anything that has been carved out.
Right. That was
And
permitted
so,
previously,
you may have something as we move forward. And we're going to continue to look at that particular number and see what is the right number. But for now, that number remains.
So I cannot have a party with 500 of my closest friends at my house on Memorial Day.
Are you buying? We could change the order. No?
Governor, I remind you
It's a
on
joke,
the
Randy.
newspaper
It's okay.
reporter.
No. The answer is no. You can't do it.
Okay, thank you.
Jim Oddie from WHIO TV in Dayton. Thank you, Governor. On behalf of our many viewers, I wanted to ask about two issues. County fairs, you must be getting close to a decision on what's going to happen with county fairs. And then bowling centers, a classic non-contact sport or activity. Are you close to making a decision on either one of those?
We'll have something shortly on both of those, Jim. I mean, we have certainly talked a lot about the fairs, county fairs. No one loves a fair more than I do. And, the importance of county fairs is, as far as I'm concerned, one of the important things, besides it's a community gathering. But it really is a chance for people in the agriculture community to get together. It's a chance mostly, though, for kids to compete, to show what they've done, take their project out and display that project, whether that's livestock or whether that is photography or some electrical project, a rocket project, all kinds. I'm just thinking of different things that our kids have had. So what we would hope is that we can figure out a way, to preserve that part of the fair. The challenge is obvious. We've made it real clear, and the science would indicate that the last thing that you could put back in place is a mass gathering of people who are crowded together. And I've been to every fair in this state one time or the other. And there's some just amazing fairs. But, part of the allure, or part of, I guess, what we like about fairs is they're crowded. And there are a lot of people coming together. And so, we worry, deeply worry about the spread that would come about. And there's no indication that we're not going to continue to deal with this COVID. It's still here. So those are the concerns. Those are the things we're thinking about. We'll have more when we do.
Thank you, Governor.
Hi, Governor. Andy Chow with Ohio Public Radio and Television State House News Bureau. I'm told I'm the last question. Yesterday, Ohio was operating under a public health order. Sounds like today we're going to be operating under a health advisory. What tangible difference do you see Ohioans acting between what they did yesterday to what they'll do today and into the future?
Great question. And I think the answer is virtually nothing. And I think, there was a concern raised. People said to us, look, and we looked at this ourselves, and we looked at it. We said the order that we're still operating under, the stay-at-home order, does not match what we have done in the orders that we've issued since the original order. And so as far as what people do, the only huge difference, I guess, but it's really not much of a difference because the travel was a request anyway. I mean, it was never a order that had any enforcement in law or that we actually ordered people. The travel advisory was to be careful about it, and we would ask people not to do it. So there's not a whole lot really of change. Again, it gives us the opportunity, gives me the opportunity, and Dr. Acton and the Lieutenant Governor to again say, look, this is really now, and it's been evolving, this is really in the hands of the people of the state of Ohio. And it kind of confirms that. And that's okay, because that's the way it should be. The people of the state of Ohio have done a great, great job. I'm getting the sign from Eric. We need to go. John, 30 seconds.
Yeah,
quick.
quickly. Andy, to help you out with that question, the stay-at-home order technically said you had to stay at home other than these exceptions. Now it essentially is going to say it's recommended but not required. Okay, most people were not staying at home. There were a whole list of things that they were doing. Moves it from required to recommended, and then the travel request that asked people to self-quarantine, that will no longer be asking them to self-quarantine just on the basis of travel unless they have symptoms or COVID themselves. So those are the major pieces, trying to clarify that for you.
Thank you.
So tomorrow is my bride's birthday. Happy birthday, Frances. My long-time girlfriend. So going back to 7th grade. So happy birthday. We're going to close today with students from the Bowling Green State University's College of Music performing "You Will Be Found," a song in the musical Dear Evan Hansen. This was played during Bowling Green's virtual celebration for spring graduation this past Saturday. Let's listen.
Comes crashing through when you need a friend to carry you, and when you're broken on the ground.